All right, welcome back. This is Studio 2121 podcast. I'm here with Keri Lipford, the director of our Assertive Community Treatment Program, ACT for short. Welcome to the podcast, Keri.
Thank you.
Nice to have you here. Just to get us started, this is my second podcast, so it's probably going to be a little bumpy, but let's just talk about your program. What is the main focus of your program?
The main goal of Assertive Community Treatment is to help people stay out of the hospital.
Okay.
Within our program, to meet criteria, you have to have a minimum of 3 inpatient hospitalizations in a year, a minimum of 180 days in the hospital within a year, or 5 hospitalizations within 2 years. We deal with severe mental health diagnosis. We also have a lot of dual diagnosis as well as substance use on top of the severe mental health diagnosis.
Give me a definition of what assertive community treatment means.
Being assertive within our approach, working within the community to decrease inpatient hospitalizations.
Oh, wow. So it's from what little bit I do know of the program, it's pretty expansive. There are a lot of different levels to the program.
Yes.
Can you go a little more in depth about how you implement the program within Westbrook and serve the clients?
Within our staff, we have a total of 13 staff. We have 3 case managers. We have 2 therapists. We have 2 registered nurses. We have 5 behavioral health techs, and then we also have a dedicated psychiatrist, which is Dr. Dugan, and she sees all of our ACT clients. We provide transportation to doctor's appointments, shopping. Our biggest goal is to link resources that they may not have right now, because a lot of times if a person's severely mentally ill or really struggles, they may not have housing or they may struggle with paying bills. We work a lot with consumer credit also, but we try to link their needs to help get them stabilized and to help them stay out of the hospital.
Wow, that's great. I've noticed with a lot of programs within Westbrook, there are so many levels to each program. That's why it's important to get this information out there, because a lot of people aren't aware of what all each program does for the client on the client end.
Yeah.
People just chalk it up to, it's just a mental health treatment, basic, services. But, who would have thought that you guys help people with housing? I mean, that's great.
Yeah.
That's another entirely new level to that program that I wouldn't have even thought. And being new, I mean, it's important, I think, for me to learn and everybody to learn about it.
Yeah.
Now, coming into the program, well, first of all, let's back it up a little bit. What made you choose Westbrook?
Honestly, I think it is the wide range of services that's offered. I think they really care about their employees. I think if you're wanting to learn more, the opportunity is there, and that's the type of person I am. I don't want to stop learning or ever stop being a student. So I think that's the main reason. But now that I have been here, I think it's more like it is focused on work, but it's also more like a family. A lot of times we spend more time at work than we do our own families. And it's healthy for a lot of people. I think it's a healthy environment to be a part of. So I absolutely love it.
Yeah, that's what I've noticed. I've been here all of 3 months now, and I'm just seeing, new faces every day, but every person I've met is extremely friendly.
Yeah.
But my biggest challenge is just learning all the programs. Mm-hmm. And, that's why I'm trying to bring everybody in and get the information out there and let everybody talk about their programs.
Yeah.
Everybody I've met has been extremely passionate about what they do, the programs that they run. So back to talking about ACT, as far as your program goes, what is I guess the best way to put it would be, what is the biggest challenge you face on a daily basis with the program?
Honestly, a lot of it, I would say right now, would be substance use. I would also say sometimes compliance. And we also know that if a person is severely mentally ill, they're not compliant with treatment. So our goal, that's what the assertive part stands for, is we're assertive within our approach. We develop relationships with them. As far as, if they want to cancel an appointment or not come in, and, 9 times out of 10 we'll knock on the door. Because we know that's what they need. The other thing I would say is it's very important to meet people where they are and don't set expectations that aren't realistic. Just meet them where they are, whether it's meeting them at their door and seeing them face to face, just to check on them. A good example is, we have some clients that struggle with showering. Some that haven't had running water. So just an example is our team got a dumpster to help somebody clean out their house, so they had access to their hot water tank. Another person we assist with showering, and they just never really had the life skills to know what it takes as far as taking care of yourself. So I would say that's the biggest thing, but I would say the biggest struggle right now is working as far as substance use and helping people find sobriety, because not everybody's ready, and it may take a long time before they are ready.
Yeah, and that's what I've been hearing from a lot of different people with their programs is it's a very client-centered approach.
Yes.
And I think it kind of has to be, because you can't force something like that.
Absolutely.
It typically goes the opposite direction if you do. I don't profess to be an expert on that. I've just, seen it with my own eyes, and that seems to be the best way to go. And like we talked about before, client-centered approach seems to be, there's a human element to that. You seem to care about the client more, and they know that. People pick up on that.
Just being humble. I think that's huge. Not expecting people to do things that they may not be capable of doing. I'm very thankful I have 4 people in recovery on my staff, because they're able to be there with our client and share some of their own experiences and helping some of our people also find sobriety. And it's an array of, if you added it up, I would say at least 13 years altogether between everybody. Our 2 nurses, they both together have over 20 years of experience. They help with all the medications. Some of our clients, we deliver their medications daily. Some of them, it may be once a week. Some people, we have their med prompts, so we actually watch them take their medications every day. And that helps with the stabilization and compliance as far as meds.
I think that's why I like this job so much, is dealing with people that really take their position seriously and love their job and love helping people. Because honestly, you're answering my questions before I can even ask them. I was getting ready to ask you. I was getting ready to ask you what the most rewarding thing about your job working in the ACT program was, and I can already see a picture of that forming just by you talking.
Oh goodness, it makes me glow. I love it. The most rewarding. I'm trying to think. Just seeing people accomplish anything that they may not have accomplished without help. Seeing people take small steps where before they would have felt like they were stigmatized. And feeling the accomplishment of it's okay for somebody not to be okay. And just developing those relationships with clients who sometimes felt like they were kind of outcasted. I think that's the most rewarding, honestly.
Yeah, and like I said, you are glowing the entire time talking about it. And I noticed that, on my first podcast with Chris about our Connections program, people are passionate when they talk about what they do here. And that's new for me, coming into a place where people actually enjoy what they're doing, they believe in it, and they're passionate about it.
Yeah.
And that's why this isn't even a job for me. It's great learning this, talking to people that like doing what they're doing.
Yeah.
As far as your day-to-day, give me just an idea of what a day-to-day looks like for you and your staff.
Every day from 9 to 10:30, we have a daily meeting where we review every single client that we serve. We review what they have that day. Our goal is to meet a minimum of four contacts per week per client. That's the goal. Whether it's, giving them additional support, therapy, transportation, doctor's appointments, med deliveries. We also help a lot with a de-escalating crisis with our clients. Typically, once we work with someone for a certain period of time, we can kind of see patterns when something's coming, or if they're having an increase in symptoms. Then on Fridays, we have a very long meeting from 9 to at least 12, and we talk about every client and everything that they did within that week. So that's probably the more so assertive approach, where we're able to talk about a game plan for the next week. With some of our substance use clients that are also struggling with mental health, we cover the enabling and how to avoid enabling. Are we helping, or are we working harder than they are? Sometimes it's a gray area, but I do think our staff is getting better educated with that and learning. And it's also from our staff that's part of recovery that is able to educate staff that may not be as educated about substance use treatment. And that's really how you get to see how everybody works together. Everybody has something different to offer, and that's the amazing part of it.
Seems like you guys really take a proactive approach versus a reactive approach to everything, to kind of just, I don't want to say put out the fires before they happen, but I mean, that's kind of what it is, really. I mean, you don't want to see somebody spiral into a problem that you could have prevented early on by recognizing the signs.
Yeah.
So
that's the biggest thing with that is communication. Just like with Assertive Community Treatment, this program, we also have clients that go to CFT or other programs. So we're in constant communication with them also. That's why communication is very important with what we do, because you're communicating with so many different people about the care of one person,
Yeah, and I've noticed that since I've started here as well. One client may see multiple departments for multiple different services, and I think that's great that we're able to offer that. And I think that ties into our CCBHC.
Yes.
Being able to offer all those different services to that client.
Yes.
I think that's very important.
Yeah.
Now, as far as, I know I've asked you about your day-to-day. Let's talk about your staff a little bit. You said they're in recovery themselves, a couple of them are?
Yes.
Okay, so how do you feel about that, as far as, does that give them an advantage when dealing with the client if they're in recovery themselves? Does that help them relate to a certain degree a little better, do you think?
Absolutely. It's easy for me to sit here and tell you to do something or tell you how to do something, but it gives it a different twist if I say, this is how I did it.
Yeah.
It changes the perception a little bit. But the good thing is, we have a therapist that's in recovery. We have a case manager in recovery. We have, behavioral health techs in recovery, which gives a broad perspective of, okay, well, if they could do that, I can do it too. And it really helps if a person is able to relate to somebody, rather than to feel like, oh, well, they don't get me, they don't understand. I think that helps a lot. And it's also an advantage with other staff that may have questions about it or may not understand certain aspects of it, or vice versa, because you may have staff that don't know a lot about it that's able to give you a different opinion that you wouldn't have thought about before. So that's the other cool part about it too.
Like we talked about previously, just a few minutes ago, you were answering questions before I could even ask them. I was getting ready to tell you, if you thought that was a good thing for the client to see someone that had actually made it through and it became successful on the other side, and that, I think that's important. I think, that hope is something that I think at this point, a lot of people have been touched by substance abuse or mental health in some way, throughout their lives. And the one thing that I've seen personally in, my experience is the people, if they got a little bit of hope, something to work towards, the outcome tends to be a little bit better.
And even if it's something small, I know one of my staff is working with an individual as far as, what is your weekly goal? What is your 1 year goal? Just breaking things down to where it's realistic, and you're not looking at something like, I'll never be able to do that,
So you guys tend to focus on small, achievable goals, small victories, and that applies to all aspects of life. I feel like, if you can set small goals for yourself that are attainable, you're winning all the time.
Yep.
And that's great. That's fantastic.
Yeah.
Well, Keri, I really appreciate you sitting down here with us today. And
no problem.
With me, should I say. I guess everyone else will be watching this when it comes out. So you've been really informational, and I appreciate you coming in.
And then if anybody ever has any questions, they can always reach out.
Okay. All right, and I'll actually put the phone number there at the bottom of the screen. That way, if anybody has any questions or anything, they can call in and ask. So,
absolutely.
Well, I appreciate you stopping by, and we're going to end the podcast here.
Thank you.
Thanks.